Hey mamas, welcome to today's workout. Today we're going to be doing a 5-minute prenatal breath workout, and this is a great primer before your workout or post-workout. One of the most important things you can do during pregnancy is focus on your breathing to help keep your core strong and maintain a strong core throughout pregnancy and heal faster. We're going to begin on hands and knees with some diaphragmatic breathing. So knees under hips, hands under shoulders. I want you to take a deep breath in. And as you do that, I want you to think about expanding your lateral ribs. So when you breathe in, expand lateral ribs, breathe into your back, breathe into your pelvic floor so you feel that breath going all the way down. Now, when you exhale, I want you to think about deflating a balloon, pulling pelvic floor in and up, bracing the lower, mid, and then letting those upper abs ribs close, and then getting all that air out of the diaphragm. So let's do that again. So we're going to inhale into those lateral ribs. So if you can see some expansion through the ribs, some expansion up here through my back. Exhale. You can see those deep core muscles engaging. Now you'll still see that belly, but you'll see it get a little bit bigger here. And you'll see it tighten and engage here and here. So we're engaging all those deep core and pelvic floor muscles, which is so important for maintaining a strong, healthy core during pregnancy, and then recovering that pelvic floor and deep core postpartum. Let's keep going. And you want to be mindful that you're not bearing down, you're not pushing. It's not a belly breath. It's not this. That's breathing into your belly, and it's not this. Breathing into your chest. It's breathing laterally through those ribs. So let's show again. And this is great for any trimester. The earlier you start, the better, but it's not too late. It just does get a little bit more challenging the further along you are. And you can continue to practice that. If you found yourself shifting forward and back, I'd put your head against a wall so you're aware of that. Okay, now we're going to do some side expansion breathing. You can do this in standing, kneeling, or seated. But what you're going to do, bring your knees under your hips or your feet under your hips. You're going to reach over to one side, and all I want you to do is focus on tucking that pelvis under, relax the glutes, but I don't want you in an anterior tilt. I don't want you arching that back. So tuck that pelvis under. Take a deep breath in, expand those lateral ribs. Exhale. And again, you're relaxed through the glutes. If it helps, if you're tensing your glutes, go ahead and stand up or sit. So you're trying to expand through those lateral ribs and breathe into these ribs here. You may be able to start to work yourself a little bit lower to the side, but what I don't want you to do is collapse. I want you to breathe into that space here, and that's going to send again that oxygen to the muscles and release that tension. We're going to do that same thing on the other side. And if you need a chair or something to hold on to, you can absolutely do that. You can do this in any position. But what we're focusing on is movement here. Can you place your hand on your ribs and you feel the ribs moving? Not just here. So chest breath would look more here. A belly breath would be more here. We're looking for that rib expansion, and that is what's going to utilize our diaphragm and deep core and pelvic floor. If you're pushing out through your belly, you're going to be bearing down, putting pressure on that pelvic floor, and that can cause excessive diastasis through the midline. That can cause excessive pressure down on the pelvic floor, which could lead to prolapse. So the more we can practice this lateral rib cage expansion and rib cage mobility, thoracic mobility, the better off we're going to be during our pregnancy. And we're going to keep maintaining some thoracic mobility. We're going to go to a thoracic cat-cow. Now again, be mindful that you're not pushing out through your belly, and I'm going to show you the difference here. Come back into hands and knees. Inhale through the lateral ribs, and as we inhale, just a slight tuck of the chin, look up. Exhale. You notice my hips aren't really moving. I'm rounding my upper spine. Inhale. Pulling those shoulder blades back and down so you're getting a little bit of retraction. Exhale. And we're engaging that deep core and pelvic floor a little bit, but it's not a full cat-cow. We're not pushing the belly out. We're just focusing on creating that mobility through the upper back, which can get so tight. And we're breathing into that space between those shoulder blades. And that's it. That's your 5-minute breath work routine. So I would suggest doing that daily, especially that diaphragmatic breathing. You could do that hands and knees like I showed you. You can also do that standing or kneeling. Same with the side body breathing. And then thoracic mobility. Those 3 things are going to be so key to maintaining a strong, healthy core and pelvic floor. First, second, third trimester, and postpartum. So it's never too late to start, even if you're nearing the end of your pregnancy. But if you're in your first trimester, do this now. And if you do anything core-wise during pregnancy, breathing is going to be so key, because our breathing gets restricted because of the shifting of organs, baby position, and just overall ligament laxity. We struggle to stay with that nice, deep diaphragmatic breath and expansion through the rib cage, and we get just really tight and tense and weak. So what we want to do is continue to maintain that strong breath, not just during exercise, but transferring that to everyday life. So if you notice when you're doing dishes, for example, I notice I start to breathe a little more up into my neck and chest. If you can try to breathe more into those ribs and just take a few deep breaths throughout your day, maybe even set a timer every hour to practice that. And that's going to set you up on a much better trajectory for your pregnancy. You can avoid severe diastasis. You can avoid severe prolapse. Now, you might still experience some diastasis, some prolapse, some pelvic floor dysfunction. That's all going to be normal and usually just a natural consequence of pregnancy. But in order to mitigate that risk of severe core dysfunction, prolapse, diastasis, recti, these exercises are going to be so key. So I wanted to really dive into that post video because I just feel so passionate about this and want to set you up on the path to recovery and just be on a good trajectory and increase your comfort while you are going through pregnancy. So anyway, if you have any questions, feel free to drop them in the comments, and I'll see you back here for our next workout together.